Thuthuzela Care Centres are rape management centres set up over a decade ago in South Africa to respond to the growing levels of sexual violence in our country. This is the story of the partnerships between government departments, civil society organizations, and international donor agencies, who together strive to change the lives of ordinary South Africans. The TCCs, as they are commonly called, are led by the National Prosecuting Authority within the Ministry of Justice and Constitutional Development, and over the past few years have been supported by the US and Danish governments, amongst others. These centres have, over the years, been managed by a small national team consisting of justice, health, social development, and police services. The aim of all this effort is to ensure dignity to every person who has been an unfortunate victim of rape, but ultimately to reach a position of zero tolerance to this scourge. Just prior to 2000, the BBC reported that a survey carried out in the South African city of Johannesburg had uncovered an alarming picture of sexual violence. 1 in 3 of the 4,000 women questioned by CIET Africa, a non-governmental organization, said that they had been raped in the past year. In a related survey conducted amongst 1,500 school children in the Soweto township, a quarter of all the boys interviewed said that jackrolling, a South African term for recreational gang rape, was fun. More than half the interviewees insisted that when a girl says no to sex, she really means yes. In 2000, the South African government created what has become a beacon of hope, the Thuthuzela Care Centres. Thuthuzela is the Xhosa word for comfort. This is the story of Thuthuzela. May it inspire you to reach out and do the same for your mothers and daughters. It is the South African government's greatest interdepartmental success story.
The Thuthuzela Care Centre model is a multidisciplinary model known in the world that brings together psychosocial and legal components to turn victims into survivors and put more perpetrators behind bars. That the true magnitude of sexual violence is hidden because of its sensitive and illegal nature. Most women and children and families do not report cases of abuse and exploitation because of the stigma, of the fear, and of the lack of trust in the authorities. Its integrated response to sexual offences has proven to be an effective model as it aims to reduce secondary trauma for survivors of sexual offences. It improves conviction rates and reduces the lead time for finalizing cases. In particular, the Thuthuzela Care Centre provides all stakeholders with a model of how multi-stakeholders concerned with the welfare, with the health, and justice for our women and children.
Advocate Toko Majokweni was there from the inception of the project.
What would be the best option for responding to rape in the country? One of the things that was clearly something to be done was to look at how is the system in itself responding to rape and attempted rape, and what would be the measures that we could put in place that would make the experience of victims better in the system, but also that would change the system itself to be more efficient, effective, expeditious, and make it empathetic.
The potential this initiative held to change the lives of ordinary South Africans was recognized by the international community. USAID committed $15 million through the Women's Justice and Empowerment Initiative in order to bolster this project.
It was a response from the Sexual Offences and Community Affairs Unit to a critical problem in South Africa. And we got involved when the program had been going on for a few years. I think we were fortunate in that we could add resources and technical assistance and value through our work and through the work of our partners like Research Triangle International to support that model. But the ownership and the sense that this is really a South African program was always there, and it's still there now.
The fact that it has been a South African government-led program. So USAID has worked very closely with the South African government through RTI as the implementing partner to ensure that the South African government has led the program at every step of the way.
So we work closely with RTI on the implementation of the program, but RTI manages the program.
The requirements of a multitude of stakeholders had to be carefully considered in the design of the TCC model.
The considerations for the design of the Thuthuzela Centre was that, one, it had to have or impact on criminal justice outcomes. We had to make sure that we respond better by ensuring that victims are turned into survivors. That we don't have a situation where a victim will come into the system and find that the system victimizes them even more or in a similar way than the offender has. So secondary victimization was one thing we had to get rid of in the system. Secondly, we had to make sure that the system is efficient in actually holding offenders accountable. So that is the issue around conviction rates. So we had to make sure that we increase the number of conviction rates in rape cases. The third issue was really about how do we ensure that the cycle time itself is shortened, because it doesn't have to take long for a conviction of rape. Very few witnesses have to testify, and we rely, in the most part, on the complaint evidence, as well as supporting evidence like your medical evidence.
The model itself is something that I think is a lesson learned, and the interdepartmental cooperation, what a TCC does. I think that's another key lesson learned or aspect of this program that can be relevant in other sectors. The fact that the program is housed within the Ministry of Justice, the Department of Justice, under the National Prosecuting Authority. But if you go out and visit a TCC and see what they do, they're all located at state-run hospitals. And the people that work in the TCCs, some of them are employees of NPA, but you also have doctors and forensic nurses that are part of the Department of Health. We work closely with NGO service providers, many of them which are supported by the Department of Social Development. Of course, a lot of times the first person that a victim of rape comes across is a police officer. So we work. The program works closely with SAPS. The program works with the Department of Basic Education. So I mean, it's also that interdepartmental approach that have a good solution to a problem. You have to have multiple stakeholders working on it to address that issue, and they have to work well together.
The cornerstone of the program is turning the victims into survivors.
The approach that we chose was one that says we need to make the victims central. Secondly, we had to make sure that we have a court-directed approach, prosecutor-led and court-directed, because if you don't have the criminal justice outcomes for victims, which is part of how they heal, which is part of the resolution of the matter for them, then there is no point in designing a system that doesn't have that as an outcome. The third area was that because the assistance to victims has to come from very, very many disciplines, we had to approach it in a way that enhances the multidisciplinarity of the service and ensuring that we hold each other so that nobody falls through the cracks, and there are no cracks to fall through.
The most important aspect of the work that we do here is that of stakeholder involvement. I think it's been very, very important to build relationships with the other stakeholders here as well. Because after all, we come from different backgrounds, different disciplines, and it's about how we marry those disciplines in our response so that the survivor herself or himself is afforded the best care possible, and that they feel supported in the system. Because that's what it's about ultimately, is how does the survivor experience support in the system, and how can we develop the relationships in such a way that we're not working against each other, but we're working with each other.
Yeah, the biggest challenge that I've had is the actual coordination of the different stakeholders. As you know, it's a multidisciplinary model. It involves the Department of Health, Social Development, police. Those are the major partners. And if any of them are not on board, and then the model doesn't really work to its optimal level.
Well, I think one of the important and good concepts that the TCC has introduced is the idea of implementation meetings. And I think at the implementation meetings, it's critical for us to discuss statistics.
The TCC model has gained international recognition.
It's been held up as a best practice model around the world. It was certified or announced as a best practice in the United Nations. It's been adopted in countries as far away as Chile and here in Africa and Ethiopia. And we've shared lessons learned with places like Benin, with places like Kenya, with places like Zambia.
We will now take a look at how the TCC model works. A rape occurs, and if the victim does not know about TCC, they will go to the local police station or clinic. Here they will be referred to their local TCC. At the Rape and Investigation Care Centre, they will be seen to by an entire medical and therapeutic team. This team includes a victim assistance officer, a counsellor, doctor, and investigating officer. These are overseen by a site coordinator. From here on, the victim is assisted by a dedicated sexual offences court. The victim is represented by a prosecutor, social worker, and her case is overseen by a case manager. A comfort room is also set aside at the court for the victim's privacy. The Rape Investigation and Care Centres have the following benefits shown here. Centralises rape investigation, transportation, victim care and examination, communication between police, victim, and court, fast and sensitive investigation, accurate data collection, and victim crisis counselling. The Sexual Offences Court works in the following manner, as shown here. Prosecutes sexual offences only, weekly strategy meetings and case assessment, consults with victims through court process, ensures speedy, more effective prosecutions, and court preparation. The overall objectives of the model are to reduce secondary victimization, increase conviction rates, and reduce cycle times of cases. The success of the model relies on the teamwork between different stakeholders.
Well, I think any multidisciplinary model will have many challenges, and this is not unique in the respect of setting up the Thuthuzela centers either. You're actually asking various government departments to come together towards a common vision, and even though that vision is one that the country has collectively, which is zero tolerance towards crime or zero tolerance towards rape, it is very difficult when you have different budgeting priorities. There's a lot of different dynamics across the centers. In many places, they move faster than others. So taking account and being mindful of those differences and those challenges, of different priorities, of political changes, has also been part of a challenge that we've had to take account over the last few years, and ensuring that we keep various stakeholders on board. Many stakeholders change along the way. We've been setting up the centers for 4 years. So ensuring that as new people come on board, we actually alert them to what needs to be done and advise them of decisions that were taken previously have also been quite difficult challenges, but all in all, we have done well.
Mandisa Ngono is a site coordinator at the Manenberg TCC. Mandisa explains the day-to-day running of the centre.
The TCC model is an interdepartmental. We're working with health, NPA, justice, social development, NGOs, and SEPs also. If I can maybe start with the roles of all of them. All of them put in their resources to the center. For example, the police, they provide us with transport for the victim, they bring them to us. Social development, they provide an organization that is providing counseling to the service to be here 24/7. So making sure that all our survivors, victim survivors, are counseled when they get here. We have health that is here, also making sure that examination happens. We have doctors that are afforded by health and nurses. We have Department of Justice, where we feed all of our cases for court purposes, where we have a case manager that would also receive all cases that are happening, that are received at the center on daily basis, making sure that those get to the court roll, and also follow up with the police to make sure that for those where suspect are known, the police do make an arrest on them. We have NGOs, which I've mentioned that they are funded by social development, that provide counseling at the center. So that organization is here 24/7, helping us to make sure that the counseling happens before examination, which makes that the survivor is a better person.
Now let's meet some of the other TCC team members on the ground.
I've seen patients walking in, getting a holistic care, living, having their forensic and medical needs completely addressed, not forgetting the psychosocial counseling and also a risk assessment to see whether there's any to placement. So there's been an improvement in that patients don't have to be sent from pillar to post for one kind of service that can be rendered under one roof.
Honestly, because I worked for the victim empowerment program in police station Soshanguve. It was a bit hard because there was no coordination. One services will be done in hospital, the other one it will be in police station, and we didn't really have a relationship with the courts and that. So comparing that with what we have with the TCC, I would really say the TCC model is way much better.
Tell them step by step what's going to happen, who's the doctor going to be. We make them at ease. So it also helps doctor to do the examination. So and then they're more relaxed. So we offer trauma counseling and support for the survivors who come here.
I, as the site coordinator, do victim management. I make sure that from the time that the victim comes in, I welcome them, and then I tell them about the services and make sure that they understand why they are here, and make sure that the services are actually provided.
The counseling happens before examination, which makes that the survivor is a better person when she gets to the examination, because we know an examination is a violation on its own.
Issues that we address on the perpetrator side is to inform the survivor and the victim that the perpetrator also has rights, and he is not guilty until a court finds him guilty. And in order for the court to find the perpetrator guilty, the survivor needs to give their support for the court.
One other thing is we just based next to informal settlements. So with most of them, others mostly will not even have a place to stay. So it's also my responsibility to make sure that, you know, a place of safety is rendered for them.
And then you can see the change, like to the day they came in here and the day when they come for the follow-up. And most of the times when we send them for ongoing counseling to the different organizations like Rape Crisis and Safe Line for the children, you can see the change when they come for the follow-ups. And at least that's the best we can do, is by referring them for ongoing counseling or to offer them shelter if they do need shelter.
What I like about this model is that you get patients coming here for queries, court progress, how is the case progressing. They come straight to the Thuthuzela. There's always someone, be it a VAO, a case manager, or a site coordinator to give them information. So that's been an eye-opener for me and a plus for this kind of model.
And, seeing victims every day getting well and, being able to assist them and, make them believe in the justice system again, it is actually what keeps me here.
Having a Thuthuzela, it makes a huge difference between what it used to be like before and what people are experiencing now.
No, it's not everywhere that you get this kind of service. Like the TCCs, there's a counselor, there's medical attention that you get. There's just by making a difference into the lives of the people, especially when they come here, they come from the crime scene, they're dirty, they're full of blood, and they smell, and just that bath that they take and the shower, and when they come out of the shower, you can see the difference on their faces.
Moving on from the rape and investigation centres to where the legal proceedings take over.
Well, first I think what is crucial to remember is that Act 32 of 2007, the new Sexual Offences Act, came into operation in December of 2007. So we were obligated by the legislation to develop a comprehensive training manual specifically for prosecutors. It's to make sure that everybody still has a good understanding of what is expected of them, and also to know, is there particular stuff that needs to be revised or that needs to be amended to put it in line with the latest developments in law. The main focus of it is to enhance the skills of either the prosecutors or the relevant stakeholders at the TCC, so that they will be better equipped to, first of all, apply the legislation, interpret the case law, and ensure that it's correctly interpreted, and that you will have a focused prosecution with better prosecutions ultimately.
That means there should be a doctors from Department of Health to conduct the examination. There should be case managers from NPA who will deal with investigations, that is prosecutor-guided investigations, will guide the police officers from the onset the docket is open until the case is taken to court and finalized.
For me, I think the emphasis that we need to put on is to ensure that the court-directedness of our cases is much more improved in terms of ensuring that the cases that get reported in the Thuthuzela Care Centres are brought to court and successfully prosecuted.
Some of the cases have gone up to court and then there has been some convictions.
When a victim comes into a center, there are various services that can be provided for her. And if those services are provided in a holistic and comprehensive fashion, then I think we would meet the needs of the victim. And it may or may not result in a conviction. And I don't think we can say we've failed that victim.
We've got 52 sites at the moment that's delivering a service for all of the victims, of which 30 of those sites are operationally in place, meaning that they're fully operational. We've basically got a tick list that we tick off the necessary boxes to ensure that all of the activities and services are in place.
In terms of reporting, in terms of the understanding of the people about the model, there were very few cases. For instance, then would average, 15, 10 cases. But now averaging 20, 25 cases up to 30 for that matter. So that to me has been a great achievement, because it means that people have become more aware of the service that we're rendering at this Thuthuzela Care Centre.
We really need to do more awareness, because they don't actually understand, most of them, why they really need to come on that 72 hours. It's not just their role, but it's also for their own benefit.
The biggest success we've ever had was when we could reach a conviction of the 95%, when we had specialized social offences courts, because then we had everything specialized, from your prosecutor to your investigating officer and to the court itself, that only sat and dealt with Thuthuzela Care Centre cases.
Without the support of USAID as well as RTI, these Thuthuzela Care Centres, not only this one, but all the Thuthuzela that we have in the province, could not have been in the state they are in without their support.
This model has had a significant impact on both rape survivor support, conviction, and prevention of rape.
What is essential is the wonderful commitment that we had so far from the relevant stakeholders to make sure that the model is implemented, to make sure that it's a victim-centered approach, court-directed, for prosecutor-guided investigations, and sufficient stakeholder cooperation. Without the involvement of our stakeholders, we will never be able to have achieved the results that we have. This is purely a collaboration between all relevant stakeholders to ultimately have a product on the table that will deliver a far more improved service for our victims out there that unfortunately were victims of sexual offences.
It creates sort of a normative framework that if you come to our centers and you have been raped, you are assured of the support, and if you actually stay long enough in the system for us to be able to finalize your case, you are more likely to end up with a conviction than where you have not been to a Thuthuzela center. Well, I think for me, the fact that with the Thuthuzelas we have more than 20,000 survivors coming into those centers saying that I have been raped, can I get assistance? I think that for me shows that in terms of how Thuthuzelas have been positioned in the system, they allow for access to justice for many people who would otherwise not have that kind of quality of justice in themselves. The best accolade was the study of violence that the UN Secretary General Kofi Annan did, where he actually pulled out, Thuthuzela as one of the best practices in the world that he has actually seen.
Creating a protective environment for our women, for our children, requires action on several fronts. This will require concerted efforts by community leaders, service providers, parents and caregivers, as well as policymakers and legislators. Prevention, however, must go hand in hand with efforts to safeguard the rights of victims of violence and abuse to special care and protection, and guarantee the swift prosecution of perpetrators.
It's an African story with a happy ending, as many women and children become survivors in South Africa. We strongly encourage you to spread the word on the Thuthuzela Care Centres. It's a multidisciplinary model that is cause for celebration.